we have spent about 15 minutes with technical problems, largely generated by myself. So I apologize for anybody if you've got a tight schedule. I won't need a lot of time. I've got to plan about a half hour plus whatever chatting we want to do. I was going to put on the screen, and I've neglected to do that. My hypothesis for this discussion, I'll read to you because I wrote it down so I wouldn't lose track of where I was going. But the growing influence of government on health care has reached a point of inefficiency and inability to deliver the best results. We will discuss our journey to this place and find some common understanding that it needs our active attention. A little bit of background about myself. I was born on a farm in Hubbard Lake area, about a dozen miles from Alpena. I have a wife and 2 sons and 7 grandchildren. And I'm blessed in the way that we're all living in Alpena. Over the years, they went on their independent journeys and returned over the last decade or so. And they now actively manage the businesses that my wife and I started. Well, actually, my father before me in the late 40s, and then we continued it from the 70s till recently. I'm an aeronautical engineer for the University of Michigan and a graduate of ACC. I've done a lot of graduate studies in mathematics in my early career, but I do not have an advanced degree. With Timm Construction was our first company, and we have since added Fiberchar, which is a wood products business, and our newest endeavor is a geothermal heat pump manufacturing company. And we've been in business, I think our first product was out 9 years ago. We have about 700 installs as of this morning's meeting. Now, what's my experience in healthcare? Beside being a patient, I was on the Alpena Hospital board for about 13 years, and it was an interesting experience. Now we're part of another conglomerate called Mid-Michigan. I've been a heart patient, unfortunately, since 2010, and I always thought I was a healthy person. And one day, while I was at work, I had an issue and ended up with a couple of stents, and that began my journey into direct need of healthcare. I have a cardiologist, obviously, and an audiologist, and an optometrist, and a family doctor. So it's somehow at the advanced age of 76, you have a lot of doctor friends. So why this subject today? Well, obviously, the subject results from my personal experience largely, and my learning and knowledge over the last decade since I was encountered this was that my health responsibility is largely my own. A lot of people think, well, when you have something wrong, you go to the doctor and he fixes it. And he can give you direction, and he can provide advice, and in almost every case, drugs. Those two subjects and the pandemic itself has encouraged me to do a little more digging and learn a little more about how we got here. You have to all admit that the pandemic has changed our lives. If you're retired, probably not so much, except your travel and your contacts may have been restricted. But in business, the influence has been very severe. And particularly on the lower income people, I think we're going to see a lot of hardship going forward. Okay, what are my observations? The public in general have a very strong and deep trust in their doctor. It historically and even to the present day, we trust our doctors. We expect them to do what's best for us. The Hippocratic Oath, almost everyone knows, is to do no harm. So we enter into a relationship with our medical business through the doctor in a very open-minded and comfortable way. Today, 70% of all Americans are on some form of drug. 70%. I grew up in a rural household and we never saw a doctor unless there was an issue. When I was a young man, I had a tumor on one of my feet and I spent a couple of days at Alpena General Hospital. But other than that, we did not go see doctors. We had a dentist that we saw periodically, but a doctor was a rare condition typically, rare intersection. Once you're in the system though today, we are taken very well care of. Our system is sophisticated and it's focused largely on taking care of people, which is a good thing. An interesting issue is that Americans' health system, while it is probably the most expensive in the world, ranks about 37th. This is older data, and I couldn't find any more current data into that, but France held the #1 position, and in the United States of America, the 37th position. I'd like to think today that that's improved, but that's the data that I have at my disposal. Back to medicine. Medicine, it turns out, is the third leading cause of death in the United States. The first cause of death is heart disease and primarily heart attacks. The second cause is lung cancer and related illnesses. And the third cause are bad medications misallocated or misused, doctors making judgment errors, surgery errors. Now, we don't expect our medicine business to be perfect, but that's a very high level of issues that obviously is a concern for all of us. Behind medicine is our brain diseases like strokes. I had a good friend just in the last week have a stroke. Locally, it's a very debilitating, and we're not sure how that outcome is going to be. Infections follow #6, diabetes, and it goes on and on, chronic illness from there. Most of what doctors are taught at the university and then practice after are the distribution of drugs and obviously the mechanics of preparing things and that sort of thing. There's very little education on the side of avoiding it or what the value of food and nutrition has. I think this is changing. I mean, we see current discussions of got meat as a plant-based diet. 10 years ago, I was the best steak eater in America. I grew up on a farm and that's how we lived. And today I'm a whole food plant-based person because I've learned since that the way for me to extend my life and to improve my daily life is to switch to plant-based as best I can. Now, I made a full 100% switch, or I should say 98% switch. Most people don't have to do that extreme a transition, but any transition to plant-based is almost always in everyone's benefit. The other thing about our current system that I think you'll all observe and concur is that we only have a few minutes with our doctor. If you have a chronic illness or see a doctor regularly for some reason, aside from a broken leg or some major thing like that, your time with your doctor is minutes. Your appointment is longer because you wait in a waiting room, and then very often you wait in this room where for him and the nurse takes your vitals. But the time that the doctor is with you is very brief. And my experience in the last decade is that much of that time he's got his face in a computer because he has to document everything that he does. And that's part of the interface we have with our government to get funding, Medicare, Medicaid, and even insurance companies. We have developed a very sophisticated system of record keeping and payment structures that have to be monitored and managed very carefully. We have a plethora of regulatory agencies. So we know about the HIPAA laws, which restrict the public disinformation. We have CDC, Center of Disease Control, which you see now is in the news every day with Dr. Fauci. We have a National Institute of Health. We have FDA. We have county health departments across America. Every county in America has a health department. There are 70-some counties in Michigan and 70-some entities. The new ACA Act has also added another regulatory layer on top of what we already have. So what's the role in our government? What did the ACA Act strive to do? Because it had some very good things in it, even though there was a lot of objection to it in many ways, particularly from businesses. I objected to it because of what it did to my employees primarily. Let's go through a few of the things that 6 points that we're trying to accomplish. The first one, as I indicated a few minutes ago, about what the medicine costs us in terms of deaths. The first item in the ACA Act was to reduce the harm caused by care. It isn't easy to do that, but that's one of their primary thoughts. Their second goal was to engage the family of the patient as a partner in getting him well. Another very important and critical need in the medicine business. As you know now, we've lost that second goal temporarily. My sister had kidney cancer and her husband couldn't even be with her during recovery. She was kept in a waiting room. He couldn't see her. We had no access when she goes for checkups. She waits in the car, doesn't even go into University Hospital. So we've taken that second element away, even though everyone knows that the care of the family and the support of the family is critical to getting well. The third item was to communicate effectively and coordinate care properly. The fourth, and this is a big one in my world, is to effective prevention and treatment practices for leading cause of mortality. I mentioned that I was a plant-based patient or citizen today. The general understanding in that world is that we could reduce heart disease by as much as 80% by simply changing our diets. We can reduce cancer in a like manner. But so that was the fourth guideline or goal of the ACA, and it is a good one. The fifth one was to work with communities to promote best practices for healthy living. I think our general hospitals and our health departments try to do that with blood pressure clinics and efforts to try to reach into the community to encourage a better lifestyles. I'm going to come back to that in a minute. And then the last thing was quality, affordable care with new delivery models. I think that's still an experiment in process now 10 years later. Let me go back to my first objection to the ACA. We have purchased and provided health care for our employees as a small general contractor from 1970 to this day. Our cost of our insurance obviously was much less 50 years ago, but at the time of the ACA, we spent about $300 per employee and then offered a like amount for their family. The ACA raised that number to $600 and $700 and $800 a month, depending on the circumstances. Our deductibles went from $2,000 or $3,000 to $5,000 to $10,000, and that would be per person, so a family could have a very significant deductible. Now, we have since worked to negotiate that down somewhat, but still the cost of our health care in our little business went from $100,000 a year to $200,000 a year almost immediately. Now, there were good things with the ACA, obviously. A lot of other people got health care. I don't know how many million actually gained, but it was significant. And it was the primary element. One of the best things that I saw in the ACA was the ability or the capability or the requirement, I should say, for insurance companies to not eliminate someone when you got sick. I had a longtime employee about 20 years ago had a heart disease, and it was so bad he couldn't work anymore. His wife had to go to work in a job that would get her health care because as soon as he had his surgery done, they cut him off, which is obviously wrong. So let's look at a little bit history of how we got here. 1935 was the Social Security Act, and that was probably one of the first major relationships that the government made directly with every person in America. And followed that 30 years later with the Medicare and Medicaid Act. None of these initiatives are bad things. We can question whether the government's the most efficient place to have them, but that's the purpose of this discussion. Another little interesting thing that came about in 1988 was that the pharmaceutical companies could not make a vaccine that didn't hurt someone somehow. And to this day, that's still the case. As much as they try, they make a judgment about the benefits and the costs are really quite severe in some cases. So the federal government passed a law that you cannot sue a pharmaceutical company for a vaccine side effect. And that has implications, which I'll also share in a moment. That law, to this day, they also did something obviously positive in that they funded a resource so that if you are hurt, because we knew they'd be hurt, that's the reason for the law, that there was a funding mechanism to help support that family. The problem is that bureaucracy has become so extensive and so severe that it sometimes takes decades to be reimbursed or even to be accepted as a cost due to vaccines. It's very hard to track what cost what. And the next subject that I'll address takes a look at that. Let me show you one other thing. I'd like to go to where government isn't always right. Our current pandemic may be an example of that. And in our next session on the 24th, we'll dig into some of the details of what that actually looks like. For today, I'm going to go back to the CDC here and see if I can find, here's an example. In 1958, the CDC said smoking does not cause cancer. And it's amazing to us to even think of this that today, but you know there were ads of doctors in the Marlboro country and all that sort of thing suggesting what's kind of a cigarette to smoke. Well, fast forward to 2012 when the CDC says vaccines do not cause autism. And that's a debatable question, but I'm going to show you one other thing that will make you think a little bit, I hope, because while it may not cause autism, something is. And in that 1970, our nation had 1 out of every 10,000 children or people were autistic. You can see the curve in front of you. If I've done this right, Richard, I hope everyone can hear me. But the curve in front of you suggests that in 2018, that is 1 in 36. That's a phenomenal influence on health. And the suspicion is that it's driven largely by vaccines. Now we know there are environmental factors as well that could cause an issue. In the last few months, we have a report over the East that is in, I think it's the state of Massachusetts, the number is 1 in 20 boys will be autistic. So it's even getting a little more severe than what it was. All right. Let me see if I can get us back to nothing here.
Dennis, are you trying to show us something on the screen?
Oh, you haven't seen it? Yeah, I have been.
Oh, you have to go to the share screen button at the bottom.
Okay, all right. Okay, share screen button. Okay, just a minute.
Green button. There's a green button on the bottom of the control, or at the control bar on the bottom.
Just a minute, I don't have it here, but I'll
take your cursor down to the bottom of the screen.
Yeah, actually, I lost the whole. I've got an icon there, but I can't see the.
At the very bottom of your computer, you should see a thing that looks like an icon that looks like a video camera.
Yes, and I got that. When I click on it, it doesn't open. Well, let's see, open, start Zoom, it says. Start Zoom.
Does it show does it say return to Zoom or return to meeting?
It actually says close all windows, start Zoom, or quit Zoom.
No, that's, if you put your cursor on it, does it show multiple windows? One of which is your image?
It does not.
Well, we can see you, but
But you can't, but I can't see the, okay, there's nothing here critical. It might have helped explain a couple of things, but you can see me and I can't even get that screen to come up. Rich, I see your name. That's the only one on my screen. Wait a minute, maybe I can, no.
If you can see my image, there should be a little.
I can see your name is all it shows, but let me look at it here. And
Yeah,
I
see if it comes up.
Exit, minimize video. Maybe there it is. On your little icon, I had an exit minimize video. Now is my screen proper, do you think?
Yeah, we can see you properly. It's just a question.
Well, let me try to see if I can pull some of those exhibits up. Here's one right now. Does that work?
No, you gotta you gotta find the share screen button. Minimize,
all right.
minimize all the things.
I see it. I can see the share screen now, Richard.
Okay, click on that.
Click on that. Okay, there I go.
A window pop up that you can select the document you want to share. Click on that.
Very good.
Do a share again.
All right, here we go. Now, can you see that?
Yes, we can.
Okay, and I said this verbally to you, so I effectively read it. That when my point was here that the government isn't always right, and it corrects itself, obviously, over decades. But this example that I showed you is the CDC in 1958 suggested that smoking didn't cause cancer. And in 2012, it suggested that autism wasn't caused by vaccines. So now if I can get back to my share screen here and see if I can find the follow-up to this was...
You go to the top of your screen now, and it should drop down a menu that says New Share.
It's interesting, huh? When I drop that down, okay, stop share. Your screen is paused. Okay, new share. I see it. In my case, it's at the top.
Right.
It is no big deal. Okay, now let's see if I can get this to work. Okay, does this chart show up, Richard?
Not yet. It didn't change.
Okay. New share. I see why too. I'm learning this. By the next time we have a session, I'll have it figured out. Here it is, I think.
And you gotta select it. There's a pop-up window.
Now, does this work? Does this work?
That works.
Okay. This follows that same discussion on this. This is CDC data, and it shows the effect of the change in rate of autism since 1970. And this is an example. This isn't everything, but it shows that in 1970 we had 1 in 10,000 cases, and today we have 1 in 36, and as I mentioned verbally, 1 in 40. Let me look at something else here. See what my next idea was. Okay, so in the let's see if this shows up. Okay, Dr. Zelenko has been in the news recently because he has determined that this hydrochloroquine was a solution to the pandemic. And after being frustrated since March trying to get this into the vernacular of the world, of the nation, he makes this comment, that peer review process. Can you see this, by the way?
No, we can't see.
I got to go back to share screen again.
Right, you have to go.
Yep. I got to go to new share.
New share and pick it up.
All right. This is fun. How's that?
Gotcha.
All right. Dr. Zelenko, you may recall it has been in the news in the last couple of months. In March of this year, his little clinic in New York, outside of the city, in a small community of 30,000 people, he has, I think, 7 or 8 doctors in his clinic. And he had determined that this hydrochloroquine would solve his problems. Out of his 2,200 patients he's treated till about a week or 2 ago, he had 2 deaths, 2. He had 4 hospitalizations, and of the 2 deaths, one of them was a 4th-stage cancer patient. So we all know that this present virus is devastating to us older folks. His observation after fighting the system and trying to get the word out was that the peer review process is antiquated and corrupt beyond repair by big pharma money. It should be eliminated by an open world source concept. Let humanity police itself. You can fool a few people sometimes, but not all the people all the time. I'm sure how to minimize this, but I'm going to try here. That's an observation by one doctor. Obviously, there are many. One other observation that I think supports my concern that we need to do some adjusting is, as I mentioned, I'm plant-based, and that's kind of an off the edge of the normal medicine. Even though I have a regular cardiologist and a regular doctor and regular eye people and regular audiologists, funding isn't provided for people that actually spend time with you. And so they go off of the funding mechanism and we pay direct. That isn't a good long-stand program, and it does eliminate people who do not have the ability to pay. My cardiologist, for example, was in the University of Michigan Med School at 18 years old. So he's not an incompetent or not a bright man. He's a very bright man. He's on the faculty, I think, of Wayne State Medical School part-time, and also practices full cardiology when his patients demand it. But generally, he tries to support people who try to work and improve their health other ways besides a stent or a drug. Although I do take a blood pressure med as well because I can't control my meds after a lifetime of abuse. The second example I'm going to show you now, if I'm learning how to do this, go to see if I can find this. You are screen sharing. Do I have to share a new share here? Here we go. This should work. Many of you may know Dr. Ellen Frank. His mom was a principal in the Alpena school system, so his mom and dad still live here. And Dr. Frank was my family doctor for a number of years. And I went to him primarily because he supported the efforts I made to improve my health and reduce my cardiovascular disease. In October of 2018, he decided to close his practice. And this letter explains his reasoning, and I'm going to read it so that it sinks in a little bit if your print is too small. Dr. Frank writes, I have said I would practice primary care until the government makes it impossible. Medicare's proposed reimbursement next year for clinics is far below clinic operations costs. It is why, with great sadness, I write this letter. Effective March 30th, 2019, I will no longer be offered primary care. After March 30th, only non-insurance services will be provided. The only viable option for private clinics is to refuse Medicare patients. However, I do not have the emotional fortitude to say goodbye each time a patient turns 65. Now, obviously, clinics provide service to Medicare patients every day. What Dr. Frank didn't say in this letter is that he would spend 15 or 20 minutes or 30 minutes or whatever it took to help a client become well. And that's the part of medicine that wasn't changed. So that's kind of my story. I hope that it reaches through and some of you identify some pieces of it. And now for the next whatever length of time you would like, I'd like us to discuss some of what I said and maybe some other things. And then before I get to that, let me just say that next on the Friday the 24th at 10 a.m., now that I've learned the ropes of the system, I hope to have a long, at least a half-hour discussion after our presentation on the pandemic and the health issues, obviously, that a pandemic suggests, but more than that, how the government has chosen to manage it, good and bad. So let's look forward to that in a week or so. And for today, let's just talk about the general circumstances we find ourselves in. I'll stand by.
Dennis, why don't you go to the top of your screen and where it says stop share, just click on that. So
Yep.
there you go.
Yep.
Thank you.
Now everybody can come on board. Is that the idea?
If you're ready.
I'm ready.
Anybody have comments, questions, thoughts? Please unmute your microphone or type in the chat box and I will read it.
I know Olin has to have a question.
My name is Chuck Austin. I'm a Chrysler retiree and 78 years old. Lost my health care when Chrysler went bankrupt. And so I've ended up doing a lot of advocacy work, including going to Washington, lobbying for changes. First of all, that the government would would make Chrysler continue the health care coverage, but eventually, when I realized I was going to end up in Medicare or Medicare Advantage, I started lobbying on those topics. But you're just addressing one simple issue, that Medicare doesn't reimburse enough, and other insurers have to make up the difference. There's a whole big area of pre-existing conditions are not covered on Medigap plans, all sorts of significant issues. But in general, I would say Medicare does a pretty good job. I mean, I
agree. Yeah.
Can
you hear me? Can I dialogue back and forth, Richard?
I can hear you. Yeah.
Okay, good, Chuck. You're absolutely right. I don't see anything wrong with what we have done with Medicare. I think it's probably one of the better governmental activities we've actually encountered on. And to clarify your comment about my point being that I'm focusing on one thing. No, what I shared with you today was an example of how cumbersome the relation is. Not that it is always bad or always good, but I think it's so, as you know, if you've been going to Washington to lobby, you know how political this has become, and you become a pawn in a big discussion between the pharmaceuticals, the American Medical Association, the American Hospital Association, and the patient.
And the lawyers.
And the lawyers, absolutely. I mean, I mentioned autism, that's a big legal war every day to help a child. And you're right, let me go back one more thing. When we employed and assured every employee for $3,000 a year, and then I became eligible for Medicare about a little about you time. I'm more than a decade ago. I'm 76, what I didn't realize is that I would pay twice as much for the supplemental insurance with free insurance from Medicare than I did before I had Medicare. And the reason I did that was so that I get full coverage, as you're mentioning, because there's so many holes in it, it doesn't cover everything.
Right.
We're fortunate if we can afford that differential, and if we can, then obviously we're blessed. You've been retired for some years, and bankruptcies of corporations are an unfortunate situation. Even though we bailed bankruptcy, we have bailed Chrysler out federally, we obviously didn't bail out the employees' future. There's always a hole in these agreements. But thank you.
Are you going to talk about Medicare in some of your in your next presentation?
No, I wasn't going to. I'm not knowledgeable to the length of that. That might be something you might generate, and I can help you.
Well, I just might urge, since mostly seniors are on this talk, that
makes sense.
It's important every year to look at your expenses. and
Yeah.
especially drug expenses, but also the cost of your Medigap or your Medicare Advantage plans.
Yeah, I
And
would.
when
Yeah.
they increase in price, there are some things the individual can do. Now, pre-existing conditions is a problem for Medigap plans, but it's important. You can save $600 to $1,000 a year sometimes.
Chuck, you're addressing really the core of the issue, the complexity of the laws, and the insurance companies in general make every effort they can to minimize their expenses, and the greatest expense is actually supporting the patient. Uh, Blue Cross and Blue Shield was originally set up by doctors to help fund the future, and it's become the elephant in the room almost. My
Right.
experience on helping a general, we would battle for 4 or 5 years to settle a given year's payment schedule from Blue Cross. We always, as you noted, subsidize the governmental programs with our business programs and our other insurances, but we still didn't collect very easily. I recall one year was like, in our budget at that time was maybe 30 million a year, and 800,000 was Blue Cross, and it sat there and took us multiple years to collect that money. So the bureaucracy itself is not efficient in the payment side, as well as, and that payment side ties directly to the healthcare side of it. And that's why, as I mentioned earlier, you've got 3 or 4 minutes with your doctor, because for him to cover that general practice cost, they can't take any time with you. They just can't.
Right.
It just isn't in the cards. It's why I went off the reservation, so to speak, because I really wanted to be well. I lost my brother at 49 years old. He passed away. My mom at 71, and my stepdad at 74. None of those things interested me at 70, and I was 66 at the time. So I said, I want to find a way. And in fairness to my cardiologist, he didn't know another way. He was never taught, or I never saw it. He's busy with his normal work. But anyway, Chuck, thank you. Any other thoughts?
All right, Dennis, you smoked me out. This is Olin.
Hi, Olin.
Can you hear me?
How are things in Kentucky?
All right. First of all, I want to thank you for coming forward for these programs, and found a lot that I learned in your comments. And one thing I really appreciate is your balanced assessment of the ACA. I have never heard such a succinct, focused presentation on both the good and the bad of that legislation. So that was great.
Thank you.
It also was new learning for me that medications are the 3rd leading cause of death in the United States.
Yes.
And that leads me to the slide you showed about the 2 CDC denials of causation between smoking and cancer, and also between vaccines and autism.
Yes.
And I was amazed too at the rate of increase of autism over the past 50 years.
Yes.
But here's my question. Most of us would look at the denial of connection between smoking and cancer. We'd look askance at that and say, here's an example of a colossal blunder by the agency that just a couple of days ago I heard Bill Gates call the best in the world for doing what it does.
Yes.
Are you also implying that the denial of cause and effect between vaccines and autism is a similar blunder, since you put the
Clearly.
2 side by side?
Clearly, I do. And let me give you a little more background. When the pandemic hit, I was aware in January, as some people were, it was leaking through, and not necessarily in the main news media, but there was an awareness that something was happening. And the CDC said, remember, Dr. Fauci said near the end of January, don't worry about it. We're good in America. We've got a great system. Don't even worry about it. And early in February, that sort of changed. And then somewhere in that time frame, late January or February, Trump stopped flights going to China, and he was criticized. And by the way, on the political side, I don't think it matters who's in the office. Although Trump is bombastic and easy to shoot at, there's always this major degradation of each other from both parties. I've got another subject. I'd love to have another talk someday about the political world we live in. There's a really great book that I just finished reading on that subject. But back to your specific question. When I started researching the virus, because as I've learned in the last decade of my life, that we're responsible for our own health. I returned from California with a very bad flu. And I was basically bedridden for almost 2 weeks. I didn't have the lung issues, but I ached from head to toe, and I didn't have a fever. So you looked at the data. This is in late March. Let's see, I returned the 8th or 9th of March. So it was early in the pandemic discussion. I had all the tests for viruses and all the COVID tests that were available, and I was negative on everything. After a few weeks later, we found out my brother-in-law, where I was staying for 10 days, had COVID-19. And the fellows that I golfed with, 2 of them had COVID-19. So I probably had it, even though the test wasn't available. And as you know, after some time, you can't check for antibodies because that just, well, they say it basically doesn't retain itself and disappears in the 4 months since then. But anyway, I was intrigued by the situation and started buying books. I had Richard send out a list of books, and I didn't read all these for this particular presentation, but a number of them are on viruses. One is on autism. And when you start studying viruses and vaccines, you automatically learn about autism because there's a huge force in America to try to make that direct correlation honest and open and an open dialogue. And we'll talk next week about why we don't have an open discussion across America, the things that Chuck mentioned and the things that we're talking about today. We tend to shut down so-called off-the-reservation people like my cardiologist. Now, we function just fine outside the system because we need the system too. But there is clearly a huge investment, and next time we'll talk about the kind of money that's invested in the Center of Disease Control by the Gates Foundation. These are philanthropic investments. They are intended to be helpful. The National Institute of Health. If you have a chance to read one book or glance through it before next Friday, pick up the one that I referenced there called, I think it's 3 Seconds to Midnight. It's by 3 virologist scientists. Not, they don't think they're medical doctors. They may be. I don't recall that. But it's a history of a vaccine and viruses and pandemics for the decades. And what we're looking at, vaccines are a subset of a vaccine family. They take the DNA and add about, there's a total of maybe 60 different chemicals and compounds in vaccines. And depending on the vaccine, obviously. They have never, ever been 100% successful. Polio is probably one of the best examples, but there are side effects to that aren't identifiable all the time. And the idea, nothing has ever been done in less than 3 or 4 years. And the idea that we will have a vaccine by the end of the year is, in the scientific world, laughable, but in the political world, it's all we talk about. So that is the influence of the government has on our medicine is severe and deep. And initially, obviously, with good intentions. The Food and Drug Administration is there for a year. But you may have also learned this during this pandemic, that 80% of our drugs are manufactured in China. Now, I've been to China for a couple of 3 weeks, and it's a wonderful place with wonderful people. The Chinese Communist Party, though, isn't so wonderful. And we cut a deal with China in many, many ways for economic reasons. But 80% of our drugs in a place where, by the way, the Food and Drug Administration can't inspect. When the FDA sends an inspection to a manufacturing plant in China, they're allowed to go into the conference room. They never get to go into the laboratory. And so the compromise that our pharmaceutical companies has made is said, well, you know, in our government, that's probably good enough. They wouldn't hurt us. Well, we don't really know that, do we? But that's what happened. That's one of the strengths of Trump's bombastic attitude is he's actually forcing us, our nation, to pay attention to these things. What the outcome is, we're not sure. I'm not sure I answered your question, Olin, but it's deep and broad, and the implications are real. I mean, they are very real.
Well, yes, you did, Dennis, and thank you. You did say there was an implication on your part by putting the cigarette and the vaccine syringe side by side, that there's no more credibility to be attached to the CDC's denial of agency in the vaccine case, as there should be in the cigarette case. So thank you for answering the question.
Clearly said.
Dennis, there is a chat question or comment that came up that one of the concerns of a number of people with autism is the definition of autism has expanded considerably over the last 50 years also.
Yes.
And is that how much of the increase are we seeing due to the expansion of definition versus what was originally a definition we started with back in the 50s?
I don't think there's any question that that's an element or that is true, and environmental influences are there as well. I think the argument for or against it is the argument for the fact that it has grown largely due to vaccines is that it parallels the use of vaccines. When I was in grade school, and maybe many of you, we had 3 or 4 vaccines. We had smallpox. I think polio was a newer one when I was actually in 7th or 8th grade, and measles and things like that. Today, a young person encounters up to 70 inoculations by the time they're 9 or 10 years old. So we have that's a whole subject and should be discussed, not necessarily related to autism directly, but the whole concept of vaccines should be a topic all by itself, and we need a better expert than I am. I read 3 or 4 books and I'm no expert, but I can tell you that let's look at it another way. I have all of us have friends with autistic children. The oldest child that I know is in his early 30s. He's living at home with his parents, and his parents are obviously concerned about his future once they are gone. And so the comment that the folks like Robert Kennedy Jr., by the way, go off aside a little bit, as an independent person, the Kennedy family was never high on our list, even though we respected President Kennedy at the highest level. There was always enough fun and games on the side with Edward's life to say, you know, they're just rich kids. Robert Kennedy Jr. has dedicated his whole life to environmental issues. As a business person, we might not think I'm an environmentalist, but I am a serious environmentalist. I care about everything we touch. In the wood business, we understand forests and the fact that you can regenerate. Back to your question about variations. If there were like autism 10 or 15 years ago, we should see those adults in our communities. And we do see some. But if it's as much as 5% of our population then as it is now, we should see evidence of that. There's, unless they pass away too early, but there should be 30 and 40 and maybe 50-year-old autistic people, and we don't have them. So we know something changed. Is it all vaccine? Probably not. The suspicion is that it's a significant influence. Any other thoughts? We probably wore out our welcome, Richard, with a late start. But again, I'm going to close with appreciation for everything.
Hey, Dennis?
Yes, sir. Yes, Olin.
Well, sorry to interrupt, but
no.
I have an amusing tale about the definition of autism. For a long time, my family members teased me about my personality and suggested to me that I had some version of Asperger's, which is on the autism
Yeah.
spectrum.
Bright
And
people.
and so I kind of rolled with it and laughed with it. We made it a kind of a family joke. But then in the latest issue of the DSM-5, I learned and was able to crow about the fact that Asperger's is no longer recognized as an illness. And so I told them, well, I never had it because it doesn't exist now, according to the experts.
Okay.
The only problem with that was the reason why it disappeared was that the characteristics of what was thought to be Asperger's can actually be found in other disorders that are mostly related to the kind of temper tantrums that 2-year-olds have.
Okay. My temper tantrums. Yeah, I was never accused or said to be have Asperger's, but I used to have a temper, and it took me a number of years to work on my way out of that. So that was a whole nother issue. I'm not sure it was part of my physiology or my mentality, but right,
anyway, the fluidity of these definitions is
they do.
something we
and
have to
by
just
the way,
roll with.
I think I skipped one item in my notes here. We have a very, very sophisticated medical system. I mean, the technology on the observation and side. When I was on the hospital board, we bought our first CT or CAT scan or upgraded it to something significant. And since there are MRIs and all sorts of nuclear technologies, I mean, we have an amazing thing. The fact that we're low in the world in terms of ability to keep our people alive is another element of it. And it's probably driven more by lifestyle than the medical establishment itself. That being said, any other thoughts for today?
Okay.
Do you want to do that?
Yes.
Okay.
The next, the second part of this presentation is going to be on Monday, August 24th. And Dennis, I'll make sure I send you the connect information in the morning.
All right, and you know, it's funny. All my emails got wiped out last night just after dinner, and I was talking to my technical guy in our business, and we couldn't get them back. So I would have probably gone back a week or so and found it. But my apologies to everyone for the inconvenience. Thank you.
Well, we oftentimes do that, but we'll make sure we do it this time. Any other questions for Dennis at this point?
My wife, Patricia, this is Olin. My wife, Patricia, has some comments she'd like to make. So go ahead, Pat.
Well, I have been a mental health advocate for some time, and I will tell you the system has of Medicare or Medicaid, whatever, has really destroyed the mental health, psychiatrists and who provide mental health. I mean, you can imagine if a doctor is going to require spending 15 to 30 minutes with people, psychiatrists have to spend
hours,
45 minutes to an hour, and they have they can't do it and have been reduced to, we have almost lost our psychiatrists who play within the system. I mean, to have mental health support is, you're paying upwards of $250 an hour.
Yes.
They have just disappeared.
By the way, I pay my cardiologist.
That's a real problem.
Yeah, no, it's a real problem. I pay my cardiologist $250 for a half hour. And, you know, he cannot compare the lifestyle that he has with his cohorts in the regular business. You're right, Pat. You know, it's a related but not the same thing. I objected to our new jail primarily not because we didn't need new cells. I objected to its construction because we had no local program to deal with. So much of what happens in a jail is driven by the mental health of people in a community. and they end up with drug issues and the related things, and we end up making them criminals. And we need to address this thing, and we're going to have to do it outside the healthcare system, I think, in the current structure, because it's so bound up in money. And as you know, Pat, if you're an advocate for mental health, you know how influential drugs are in that world. It's very significant.
Right.
It's necessary, but it's also needs monitoring. It isn't the sort of thing you prescribe and walk away for a year. That doesn't happen. It doesn't happen.
Yes, that's true. And if you look at statistics, you will find that a good majority of people who are in prisons
Yep.
are, in fact, they are people who have mental health problems.
Yep.
And the problem with, I think, with law enforcement now is they don't really know what to do with people
That's correct.
with mental health problems. They put them,
That's
instead
correct.
of taking them to the hospital, they take them to jail.
That's correct.
I
You're
have
absolutely
had-
right. Yeah, you're right. And this whole discussion on reducing police forces is really a truncated discussion in this sense. There is a need to embellish the enforcement service with a caring service. So the fact that we're defunding police is misleading. What we need is somewhat reallocation, but more than removing the police, we need to add to them this kind of arm. I mean, we're not going to go to a counselor when the guy just robbed the bank. And we're not going to go to a counselor when they've just beat up his wife. But we need to have a counselor a second later there, after they've settled the major crime down. They've got to deal with the source of the crime. And we aren't doing that. And I'm not sure we can blame anyone for that. I think it's a natural process we've got to go through as the nation grows and heals and becomes more sophisticated.
Thank you.
Thank you, Pat.
Well, we probably, just from a perspective of mental illness, that's good. There's a lot of discussion needs to happen there. There's never been, I don't think, a good solution. We used to have big mental hospital institutions where we put people in it, and we got rid of those, and now they go to jail, and it hasn't solved. That certainly doesn't solve the problem either. So,
Yeah, that's right.
Any other questions for Dennis?
I think we've done it.
Okay, on Monday next week, or next time we do this on the 24th, I'll make sure I'll send the connect information so you have it right in front of you.
Thank you, my friend. Good to meet you a little bit visually too today. So thank you, everybody, and enjoy the rest of the weekend, or the weekend is ahead, and thank you very much for the opportunity to share. Next meeting will be a little more hard-hitting because I have some stronger opinions. God bless you all.
Okay, thanks.